Hello and welcome to a special episode of Prescribe Orally. Today we're going to be challenging each other with some cool questions.
Aye.
So
using a unnamed question bank because we're not sponsored.
Stay till the end of the video to see who actually wins this video.
Yeah.
Yeah.
It'll be me. It'll be me.
It's a bunch of losers.
It'll be me. Yeah. I'll win. Look at the man's mustache. My goodness. That's not a winning mustache there.
At least I can grow hair on my face. Low blow. Boom.
That's a bit out of pocket, that one. Alright. For that there, you're doing this one first.
Okay. So,
right.
Right off the bat, Chris, I have a
good
question for you.
What's this gonna... No, I'm asking you this one.
Okay, go ahead.
Yeah.
Go ahead.
Alrighty, so we have a 72-year-old man who presents with a 2-month history of worsening shortness of breath and poor exercise tolerance. Background of rheumatic heart disease. In addition to this, he has hypertension, type 2 diabetes, and has had a previous MI 3 years ago. MI being a heart attack for non-medical ones.
Was that a jab at me?
No.
Okay.
It's to help our viewers.
I know what MI means, alright. Mission Impossible.
Yeah.
Go on ahead. Sorry.
Alright. So, on examination, he is mildly breathless at rest. Auscultations, so listen to his chest, reveals inspiratory crepitations at the lung bases bilaterally. An early diastolic murmur, heard loudest at the lower left sternal edge.
Yeah.
And is exacerbated by the patient leaning forward. His pulse is regular with a rate of 75 and there's no peripheral edema. Which of the following is the most appropriate investigation for diagnosing his condition? So
that would be a TTE without even looking at the answers.
We have 5 options. We may as well read it out to them. You know. So first option's transthoracic echocardiogram.
Yeah.
Second option ECG. Third option cardiac catheterization. Fourth option is a CT coronary angiogram, and the last option is a chest X-ray. So you're going with a TTE.
Yes. So judging by the question here, I think this is relating to heart failure. You know that's what this. So like your shortness of breath, bilateral, inspiratory crepitations, and also whenever the patient's leaning forward. It's exacerbated. I do think this is going along the heart failure route. Okay. So I think it's it's not. I think it is. It is TTE.
Okay.
Confidence. What do you think it is?
Say it with your chest. I would tend to agree with you. Also, by the way, that it asked the question, it says which of the following is the most appropriate investigation for diagnosis of his condition.
Yeah.
ECG isn't going to diagnose what this is. Neither is a chest X-ray. Cardiac catheterization.
I don't think it's going to diagnose it.
Don't
That's
think
sort
so.
of like a.
Yeah. Is that also not like more? Well, CT coronary angiograms looking at your coronary arteries.
Yeah. So I don't. Yeah.
So I do think TT fits the best.
Okay.
You're right.
Well, bam. And what exactly was it, Chris? It's rheumatic heart disease.
Yeah, rheumatic heart disease.
Yeah, my reason was
with a complicating pulmonary edema to a mild degree. And echocardiogram is the gold standard for assessment of a valvular disease. So if you think of valves, do echoes. Makes sense. There's a murmur. You need to find out what that murmur is.
So ignore everything I said. Early diastolic murmur exacerbated by leaning forward indicates aortic regurgitation. Yeah.
With complicating
can that
pulmonary
indicate
edema.
in heart failure too?
I feel like the crackles heard at the lung bases makes you think of pulmonary edema. Person also had poor exercise tolerance, shortness of breath, which is heart failure as well.
It was in my differentials.
I would say it's a differential.
Bang.
What, 72-year-old as well? Yeah.
Bang. That's good.
Alright.
Next question. Alright, Chris, you ready for this?
Yep. Are you ready to do this?
I'm on 1. You're on 0 at the minute.
Okay, yeah, that's fine.
Okay. So a 27-year-old male has been offered testing for TB, and he currently lives in London with his wife, who has recently tested positive for active TB. He moved to UK from India at the age of 17. No significant past medical history. Currently feeling well with no symptoms and no signs of active TB. Again, no cough, no fever, no night sweats, and he does remember having a BCG vaccination. What test is he most likely to have been offered? So you've got your chest X-ray, you got your NAT, nucleic acid amplification test, you got your Mantox, you got your sputum culture, you got your HIV test.
Mantox. It's the Man 2 test. Mantox.
Get this right, bro. All right, before laughing too much.
I do think it is Man 2 test.
Why is that?
Well, it's not going to be chest X-ray. It's not going to be an HIV test. Nucleic acid amplification test.
Where have I heard that before?
That's been used for your sort of more STIs.
Okay.
So I rule that out. If it's used in TB stuff as well, sue me. I don't remember. Sputum culture I could see. But just so happens that TB is not a strong suit of mine. So I'm going to go with Man 2.
Do you know I'll go with it too?
You're agreeing?
Yeah.
Yeah. Excellent. Okay.
So why not the sputum culture? It's because
It's part of a workup for active TB.
Yeah.
3 samples should be sent, including an early morning sample. However, this will not be used to diagnose a latent
so
TB.
we're looking at like a latent stage for this man, realistically. So
Mhm.
like Man
2.
2 test is
Mantux.
Mantox test is way better.
My goodness.
So yeah,
let's see.
crack on with the next question,
Aye.
Chris.
Yeah.
Tougher.
Alright, so 1-1.
1
all.
1 all.
1 love. It's like tennis.
1 all.
1 love.
1 all.
Oh,
Right,
wait,
next
love
question,
means 0,
zero.
doesn't it?
Yeah.
Alright, 26-year-old male brought to the ED after falling on his bike in a motor vehicle accident. Aside from the abrasion wounds, he is found to have difficulty lifting his right arm. Upon further examination, a diagnosis of Erb's palsy is made, which the following findings is most likely found in this patient, which led to the diagnosis of Erb's palsy.
No. What else the answers, Chris?
First option is a total claw hand.
Uh-huh.
Second option, impaired wrist flexion and elbow flexion. Third option, impaired wrist extension and elbow extension.
Yeah.
Fourth option, hand of benediction. Fifth option, impaired wrist extension and elbow flexion.
So, who is the herb? That's what we need to look at.
Herb.
I have.
I think I know this.
You think you know it?
Yeah.
Well,
We should do forfeits. We should do forfeits.
Let me tell you.
I get to shave your mustache if you lose this.
No. We'll start forfeit from the next video onwards. I do
Alright.
have good forfeit ideas.
Okay.
So stay tuned for that.
Okay.
So, right. It's not total claw hand. Take that out for me.
Yeah.
Hands of benediction, even though it sounds cool, it's not for me.
Hand of benediction. But
Don't care. I'm going to call it hands of benediction now.
Okay.
When we start a new game, that's going to be like our
that's
flipping
gonna
highlight move.
okay.
Hands of benediction.
Yeah. Just
Bang!
really whack
Sorry.
it. Yeah.
And take out wrist flexion for me.
The wrist flexion. Yep.
Impaired wrist flexion and elbow flexion.
Yep. Alright, so you
So I
brought
think
it down
it's-
to 2.
I think it's impaired wrist extension and elbow flexion.
Okay. And what do you think an Erb's palsy is?
It's the palsy of the herb.
Do you know what it looks like?
Impaired wrist extension and elbow flexion.
I think is that the waiter's tip palsy.
Yeah.
I'm not tall enough to actually show.
That
my
is Erb's,
hand.
yeah.
So that's Erb's. You
Yeah.
stand up and do it because they need this show.
It's fine.
Basically, it's like your hands in this position here, but straight,
Yeah.
and it's like, I don't know. It's like it's a waiter trying to sneak a wee tip. I used to work as a waiter, so I can say that.
Yeah. So
You
it
can
is.
sneak a wee tip off someone.
It
you
is
know.
impaired
Yeah.
wrist extension and
Yeah, so you can't extend the
Extend
wrist or
or
you
flex
can't
the elbow.
bend the arm.
Yeah.
Yeah. Let's see if we're right. Well,
are you going with that too?
Yeah, I'm going with that.
Boom!
2-1,
baby. 2-1. Yeah.
Yep, and patients often present with the characteristic waiter's tip, which involves a flexed wrist, extended forearm, and an internally rotated adducted arm. Boom.
What do you know? I'm a king of herb.
Aye.
Herbs man.
Herbs. What nerve root? For a bonus question, what nerve root is Erb's palsy involving?
I think it's C5 and C6.
Did you read that? Oh, you did. You did. Damn. Okay. Fair enough. You were faster. I wanted to test you without looking.
Well, C345 keeps the diaphragm alive, bro.
Okay.
C567 arms to heaven.
Yeah.
Yeah.
Yo, we remember our own videos. Alrighty. Right, my turn.
Okay, Chris. I'm gonna chuck a hard question here.
Okay.
Right. So an 80-year-old woman is brought in by her son to the GP. She's not been in her usual self. Okay. For the past 3 days. She appears more tired and sleepy than usual. Does not join in family conversations. Her son says she sometimes cries alone after her husband passed away 2 months ago.
Okay.
Yeah. In addition, she's been more forgetful than usual for the past 4 months and frequently misplaces her belongings. She's been constipated for the past week. Abdominal examinations show no abnormalities. A digital rectal examination reveals fecal impaction. Neurological examination shows no abnormalities. Okay. What is the most likely diagnosis? So you've got uncomplicated grief, hypothyroidism, depression, delirium, and dementia.
Wow. Okay.
It is a hard one. Sorry.
This is a hard
Actually,
one.
I'm not sorry. To be honest, I'm 2-1 at the minute. So
Well, I can get rid of hypothyroidism off the bat.
okay.
Just because it doesn't say anything about any blood tests being done, doesn't say anything about any change in her appearance or any weight gain.
Mm-hmm.
It does say about being more tired. This could literally be the uncomplicated grief. She's lost her husband 2 months ago.
This is way too easy.
It's way too easy.
Way too easy now. Now that I've
Way
looked at it.
Now that you've looked at it,
Yeah.
I think it's depression because you can get pseudo dementia,
Mm-hmm.
which is basically when an elderly person is depressed, they will have certain dementia signs.
Yeah.
Like the forgetting of belongings.
That's exactly what I would have been for.
The one thing that's confusing me is the being constipated, because being constipated can increase your chance of delirium. However, there's no other signs of there being, her unwell, having kidney problems or anything like that there. So I'm going to stick with my guns of depression.
So am I.
You're going to go with depression as
Yeah.
well? Delirium.
It's 2-1
Alrighty.
still. Wow.
Depression is a differential diagnosis for this woman and is
Yeah.
commonly confused with hypoactive delirium. However, this woman does not have any overt signs and symptoms of depression, e.g. low mood, anhedonia, loss of appetite, worthlessness. Did not say that she had low mood.
Yeah, it did.
Aye, well. Delirium is a state of mental confusion that can last from hours to weeks. This can be caused by infections, urinary retention, and drugs. There's hypoactive, hyperactive, and mixed delirium. This is most likely the hypoactive form, secondary to constipation. See, you should have been quiet, because I feel like I could have worked towards delirium, given a chance.
Yeah. You're taking too long, bro. There's like a time limit in these kind of
Oh, for
scenarios.
goodness sake. Okay, whatever.
Yeah.
Right, your turn. You're 2-1.
2-1.
Yeah. Okay.
This baby.
Question 5. The parents of a newborn baby girl are worried about a red spot on her cheek. The baby had an uncomplicated birth and there are no other health concerns. On examination, there's a small erythematous papule on the right side of her neck. It is non-blanching. What is the most appropriate action to take? Is it A, refer for a surgical excision, B, refer for a phototherapy, C, refer for a skin biopsy, D, reassure the parents, or E, review after 3 months?
So take away all the referrals for me off the
Okay.
bat.
Okay.
I would not refer for and I am stuck. Not gonna lie, I'm stuck, kind of stuck between reassure the parents and review after 3 months.
What do you think this is?
Red spot on her neck, non-blanching. Is blanching worse or non-blanching worse?
No, I think not. So, depends.
Depends on the scenario, doesn't it?
Yeah. If I said something there, it would have given it away.
Yeah, no, I think I'll review after 3 months just to be safe.
Okay.
Okay.
You're sticking with that?
I'm sticking with that, yeah.
I'm gonna assume that this is a hemangioma. newborn red
Yes.
papule,
Red papule,
that doesn't
yeah.
blanch.
Yeah.
So if it's around the eye,
That's
you would definitely have concern over it growing over time and encroaching her vision, and then you'd go for surgical excision, I
Yeah.
believe.
Since it's on the neck,
Since on the neck, I would
that's why I said
say
review.
you review after 3 months. It's either going to be review after 3 months or
or
reassure the parents.
See, I've narrowed it down.
Yeah.
There
So
we go.
let's see.
Oh, nah.
Well, we were right that it was a hemangioma. However, it says here that you reassure the parents. And they're often small, harmless, and require no treatment. They may get smaller with age, so you wouldn't review after 3 months. You just reassure. I feel like if this was on encroaching her eye, it would be a review.
Yeah, of course. Yeah, no, I got you.
But
so, that's 2-1 still.
yeah, I've got time to come back from this.
So, we're going to be quick and slick. 65-year-old male presents to the ophthalmology emergency clinic. 1-day history of painless loss of vision in the right eye. Reports a complete absence of vision on this eye. He has past medical history of significant hypertension, hyperlipidemia, type 2 diabetes mellitus. Type 2 diabetes mellitus?
Yep.
So, on examination, the right retina is diffusely pale, except for the macula, which is bright and red colour. Visual field assessment showed a complete monocular scotoma in the right eye. Scotoma.
Oh my
right eye. Yeah, examination of the left eye is unremarkable. So, right eye, painless loss in vision, macula is red, retina's diffusely pale. What do you think it is? There's central retinal artery occlusion, branch retinal vein occlusion, vitreous hemorrhage, central retinal vein occlusion, branch retinal artery occlusion.
It's complete painless loss of vision.
Yeah.
I haven't done ophthalmology in ages, so this is going to be fun.
Still 2-1. That's what I hear here.
Yeah. I'm stuck between central retinal artery occlusion and central retinal vein occlusion.
Okay.
I feel like the deciding factor is the painless part.
Clock's ticking. TikTok.
The right retina is diffusely pale, which has a bright red.
TikTok.
Ooh.
What are you going for? Retinal. Oh, and he goes for central retinal artery occlusion.
Yeah, what do you think?
I think it is vein, but I'm not really sure. Ophthalmology.
I feel like this is kind of like deal or no deal.
Yeah.
Like, do I take the swap or not?
You don't take my word for it. Go with the first answer you went with.
Okay. Yeah. Ready?
Yeah.
Yeah. Yes. All right.
And he's back on 2-2.
Yeah, we're
That
2-2.
is-
So, essential retinal vein occlusion and vitreous hemorrhage all present with acute painless loss of mononuclear vision, but the fundus described here is consistent with the central retinal artery occlusion. So the pale retina but bright red macula is indicating the central retinal artery, as the macula doesn't receive blood flow. Okay.
Cool. Interesting.
Sweet.
Right. On the next one.
Class. Alrighty, you're one.
Yeah.
2-2. 44-year-old woman presents to her GP complaining of cold hands and fingertips that turn white and blue in the cold. On examination, her hands are diffusely swollen and stiff, with areas of thickened hard skin. She has also experienced abdominal bloating and constipation worsening over the past year. She has had a dry cough over the several weeks. Which of the following is the most likely diagnosis? Is it A, metastatic ovarian cancer, B, mixed connective tissue disease, C, diffuse systemic sclerosis, D, primary rheumatoid, and E, limited cutaneous sclerosis?
Take out the cancer,
Yep.
mixed connective tissue disease, and primary Raynaud's.
Okay.
I am now stuck between diffuse and limited. I know limited is crest, so that is your Raynaud's. That's all I remember from crest. Calcium Hypercalcemia?
Calcinosis, I think. So like you'll
Calcinosis,
get
yeah.
weird nodules on the forearms.
Yeah, hands are diffusely swollen, stiff, area of thickened, hardened skin. I do think it's limited cutaneous. Oh, constipation. It is kind of diffuse, to be honest. Dry cough over several weeks. I'm gonna go with diffuse.
You going with diffuse?
Mm-hmm.
Locking that in.
Logging that in. Final answer.
Final answer. See if you're right.
Yeah.
Yeah, you are.
Fine.
Yep.
So yeah, there's a potential because I came to that conclusion because there's quite a lot of systemic involvement. Limited would be sort of limited, right?
Your limited is
Your crest,
known as crest syndrome. So your calcinosis,
Raynaud's.
Raynaud's, esophageal dysmotility, so your dysphagia or
Yeah.
gourd, sclerodactyly, bright shiny skin of hands and feet,
Yeah.
and telangiectasia, which is like your red blood vessels over the nose.
Over the nose, yeah.
Which it wasn't showing 4 or 5 of those.
And the features of diffuse is a multi-system autoimmune. So like, you know,
You had your internal organs, your
everything.
problems.
Digital pit. It also has telangiectasia.
Yeah,
Like,
true.
yeah. Okay, cool.
Yeah.
Easy. 3-2. Let's go. Next speed.
Ooh, okay.
43-year-old man is described by his colleagues as cold and strange.
Okay.
Oh yeah, I'm reading the question to you. Sorry. He's never been in a meaningful relationship. Prefers to be to live alone. At social events, he seems distant and displays little emotion. He has few friends, and his only hobbies include reading alone. His parents say he's not been this way since he was a child. No, he has been this way since he was a child. So, what personality disorder is this patient most likely to have? So, we've got schizoid,
yeah.
avoidant, paranoid, narcissistic, aka Christopher Knocker syndrome,
Wow.
and schizotypal.
It's schizotypal.
Typal, same thing.
I'm locking in schizoid right off the bat.
Right off the bat. No, not even a question asked about it.
No.
Okay.
This is this is like such a typical sign of schizophrenia, is this sort of inability to socialize. Paranoid, there would be something about him, the patient, being worried about something, overly cautious, that the FBI are following him, things like that there. Narcissistic is a more grandiose idea. They think they are the best in the world, or they have come to this grand conclusion. Schizotypal, I think, is schizophrenia with what?
Schizotypal.
It's some of the schizophrenia symptoms, but I don't think it's this type, so I'm locking in schizoid.
Okay, cool.
Boom, I was right.
That is
Lack of interest of others,
3-all.
apathetic, and lack of emotional breadth. Boom.
Okay,
go me.
interesting.
Schizotypal personality disorder is characterized by a pattern of extreme difficulty interacting socially. But yeah, I want to look at that. Or magical thinking and distorted perceptions as well. Okay. All right, your question.
Right,
So we're 3-all.
3-all.
A 34-year-old woman is having an emergency cesarean section. She's not fasted. The anaesthetist decided she'll need a rapid sequence induction. They asked the operating department practitioner to apply pressure between the first tracheal ring and the thyroid cartilage. What is the purpose of this? Wow, this is some question here. A, reduces risk of aspiration. B, prevents passive regurgitation of gastric contents. C, identification of airway anatomy. D, stabilizing the trachea. Or E, vagus nerve stimulation.
Okay, so I'm gonna say take out identification of airway anatomy, and it's stabilizing the trachea.
Okay.
There's no way you stabilize trachea like that, man. Prevents passive regurgitation of gastric contents. Take that out, and reduces the risk. I'm gonna say it's a vagus nerve stimulation.
Vagus nerve stimulation?
Yeah. Do you know why?
Why? Guess.
No.
You're guessing.
I'll tell you after the answer's shown.
Okay. We'll see how it goes. Yeah. Prevents passive regurgitation of gastric contents.
Oh, it's gastric content. Sorry, I didn't.
Oh yeah, of
Should've got
course,
that.
yeah, duh. Oh yeah, no, he says so, yeah.
Carotid sinus
The rationale for this is that the upper esophagus is occluded by pressing down on that area, which prevents the passive reflux. And it's only about 10 newtons of force is applied by thumb and index pressure.
God damn. Interesting. Okay.
I actually didn't know that one.
Oh, did you?
Yeah.
Did you know?
Yeah, I did. Yeah.
That's what I would say too.
Yeah. Well, it makes sense. It says in the stem of the question she's not fasted, so it's going to be something about
Yeah,
aspirin.
of course. Carry on. Right. If you get this right, you win this.
Do you?
Yeah.
Oh.
This is the finale. If you don't get this right,
Oh, okay.
it's even Stevens, boy.
This isn't an easy question to be fair.
So, a 60-year-old man presents
me.
to the clinic, complains of pain and weakness in his legs over the last few months. Also noticed a change in his gait. On examination, his reflexes are brisk bilaterally in the legs. His gait is also noticed to be scissoring, and a cranial nerve examination reveals a brisk jaw reflex. His voice sounds strained. His sensory examination is normal. His mini mental state examination is completely normal. What is the diagnosis?
Oh.
So you've got your amyotrophic lateral sclerosis. You've got progressive muscular atrophy, primary lateral sclerosis, progressive bulbar palsy, and polio.
I've taken out polio immediately.
Okay. TikTok.
Going for... I'm not 100% sure on any of these, to be completely honest.
That's okay.
These are all various types of neuro problems.
Time to take them away.
I'm going to go with ALS.
Okay.
Yeah.
Why is that? Any reason?
That's motor neurons. This seems
Okay.
pretty, the strained voice, the changing gait, and also it's an upper motor neuron lesion because you've got increased reflexes of the legs.
Yeah.
I could be mixing this up, but I
Could be.
think that's what it is. I think if it's upper motor neuron, you've got brisker reflexes,
Okay.
and the age of the man, 60 years old.
Yeah.
But yeah, let's see if I'm right. What do you think? You're not sure either.
Yeah. We'll see when the answer comes, isn't it?
Come on,
yeah.
aye,
Yeah,
right,
that's what
okay.
you did last time.
Ah,
I was thinking PLS, to be honest.
oh really?
Yeah. Do you know
Okay.
like you were... I actually knew this.
Okay.
So, you
Okay,
just
so
need to remember-
ALS is a mixture of upper and lower motor neuron picture.
Yeah, so that's where you went wrong. PLS is primarily upper motor,
Yeah.
and it's
Whereas
these
all
initial
of these
bed
symptoms
cells
are
and-
upper motor neuron
Yeah.
lesions. Well, I got the brisk.
You got the upper motor neuron lesion right.
Yeah, I got
so,
that right.
That's the end of this video.
Yeah.
Anyway,
So that
that's
answer
it.
was primary lateral sclerosis. Yeah.
And going by a whooping 3 versus 3,
Yeah.
this ends in a draw. So we're going to come back with another video to see who actually wins
Da-da-da.
in the next video.
Yeah.
Feel
See
free
you
to check
guys.
out our other videos. Also, comment below and like, share, and subscribe.
Yeah. Watch the podcast.
Watch the podcast.
Um,
Everything. We're on all sorts of social
TikTok,
media. So go
Instagram, the whole shebang.
nuts. Yeah.
MySpace.
Bebo.
See you.